this forum. My question kind of piggybacks off of where he was going. And what I mean is that you guys are saying that this is going to make business more competitive, okay? Well, and at the same time, you're saying that you're going to be able to keep your insurance right now if you like it. Well, here's my question, Congressman. Because from what I can see is that this bill that you guys have in Congress puts in 39 states, between a combination of federal taxes and state taxes, will push taxes upwards of 54%. Now that's in 39 states, and in the majority of states, you would have, and this is for taxes on small businesses, businesses making $250,000 a year or more. That's a lot of businesses in this country. That's more than half of the small businesses in this country. So it's going to raise those taxes in 39 states. I'm not done yet. It's going to raise those taxes in 39 states higher than it is in communist China. And then it's going to also bring taxes up. It's also going to bring taxes up over 50% in most states. Now, here's the thing. Now, do you believe that higher taxes on small businesses makes them more competitive? And secondly, I don't believe that you think that, because you seem like a reasonable guy. The only way I can see that it would make these businesses more competitive is if they would have the option of dumping their employees onto the public option. So now, how do you reconcile those two talking points?
Great, good question. And this one gets to the revenue. How do you pay for it? Am I correct? This is really a how do you pay for it question, in particular small businesses.
I'll tell you what, it's interesting that this gentleman brought up the public health service that was created in 1798, because that's not entirely true. What John Adams actually did was he created the Merchant Marine Service, which was a program paid for by Merchant Marines for Merchant Marines. They had to eventually discard that service because it was always underfunded and people were denied access to the care.
Let me take the first, just before we talk about it. Here's what it does actually, all right? What it says is the cost of this plan that went through the House, is going through the House side, is about $1.02 trillion. It found $550 billion, and I'm happy to get into this with the next question, through legitimate cost savings. The Congressional Budget Office validated this. Now, the other one came from revenue. The figure in the last 8 years, and I'm happy to provide these studies to you, 53% of all tax cuts went to the top 1% of wage earners. So, if you were a millionaire in the last Bush tax cut, you got a Lexus back. But if you earned $40,000 or below, you got a tank of gas back. A year ago, that was worth a lot. Now, what this bill says, therefore, is we're all paying for the uninsured anyway. Remember, I said that's about $1,100 per family. So what it says is those who make a profit of $350,000 to $450,000 will pay 1% surcharge on that. If you make $450,000 to $550,000, you pay that was 1.2. The next one was 1.5, and then if you make $1 million or more, you pay 5.2. That's where you get the other $500 billion. Now, if I could. Small businesses. The analysis that we've run shows that of those who make that much of small businesses is about 4% of all small businesses in America. In Pennsylvania, the initial analysis shows it's a little less. It's about 2%. Mind you, this $350,000 is profit. So if you want to hire somebody, that cost is already included beforehand, so it didn't stop the interest of going over and hiring more, creating jobs. We ensured it was after you made the profit of where it went. And we did it. Now, I will want to go back to how it originally started because I think, sir, there was a better way to do it. I'm going to tell you that right now. But the way we did it is make sure it was those that had profited over the past years and kind of put them back where they were in the tax bracket, the very more well-to-do, in the Reagan and the Clinton era. Now, President Obama initially, and I think his proposal was the right one, he had done it by doing the following. If you're a millionaire and you have a home, you're in the 35% tax bracket, when you deduct your mortgage, or you get to keep 35 cents. You know, $1, you get that. But your secretary, he or she, who's in the 22% tax bracket, gets to keep 22%. Well, wait a minute. Why does the millionaire get 35 cents in tax avoidance for $1 million home, while somebody over here only gets to keep 22 cents and they don't make it? So his...
Into communists. Let's all be communists.
Shut up.
Okay, so
His
proposal, I thought, was a better proposal than how we ended up. But, sir, I'm happy to give you these studies of why what isn't going to stagnate business.
I asked you, how could you say that this is going to make businesses more competitive when it's going to raise their tax levels, and at the same time, the only way I can see that happening is if they dump these employees onto the public option?
No. What happens is, right now, because they pay 18% more for their private health care plan, according to the Commonwealth study, than a big business like Chris mentioned, with 29,000 employees. So now what they do is they get to spread the risk among all these health care plans. And they can spread the risk among them. So that the cost of their, presently they pay 18% more, so they're not as competitive.
What you're saying is that a person who is a younger person who has a better health condition is actually paying for the person who doesn't.
Very good question. That's a great question and a great point. It is true. Because what I said, if you remember, is I'm a mandator. Person who's 30 years old and doesn't have health insurance, I feel should have health insurance, even though the need for it is less. Because
you're saying choice. I mean, the next word out of your mouth after choice is mandate. There's no such thing as a choice mandate.
Right.
If you have a choice, I'm 35 years old. I do not have health insurance right now, and at the moment, I don't want to buy it. So what gives you the right? What gives you the right to tell me that I have to go and buy something that I don't want?
And so, and this, if I could, I'm going to try to, if I could, everybody, I want to answer this question. Is that all right? Hey, please, it's a legitimate question. It's a very legitimate question. Let me just finish it up, please. Because this is, I owe him. This is where people can differ. For example, should we mandate that everybody has car insurance like we do? So my take on it is that if somebody, I said a mandate that everybody is in it, because I believe that we're paying for the uninsured anyway when they get ill, so I don't think that's fair. Number two I do believe, though, that that individual should have a choice of which healthcare plan he or she wants to be in.